What about postpartum care? What are the recommendations? Recommendations that insulin resistance decrease dramatically immediately postpartum, and insulin requirements need to be evaluated and adjusted as they are often roughly have pregnancy requirement for the initial few days postpartum. So a contraceptive plan should be discussed and implemented with all women with diabetes of reproductive potential. Screen women with a recent history of gestational diabetes mellitus at 4 to 12 weeks postpartum using 75 gram oral glucose tolerance test and clinically appropriate non-pregnancy diagnostic criteria. Women with a history of gestational diabetes mellitus found to have prediabetes should receive intensive lifestyle interventions and or metformin to prevent diabetes. Women with a history of gestational diabetes mellitus should have lifelong screening for development of type 2 diabetes or prediabetes every 1 to 3 years. So women with a history of gestational diabetes mellitus should seek preconception screening for diabetes and preconceptions care to identify and treat hyperglycemia and prevent congenital malformation. Postpartum care should include psychological assessment and supportive foster care. What about postpartum care in GDM? Initial testing, because GDM often represents previously undiagnosed prediabetes, type 2 diabetes, maturity onset diabetes of the young, or even developing type 1 diabetes. Women with GDM should be tested for persistent diabetes and or prediabetes at 4 to 12 weeks postpartum with fasting oral glucose tolerance test using 75 gram and non-pregnancy criteria. Here we'll go about for postpartum follow-up. The OGTT is recommended over A1C at 4 to 12 weeks postpartum because A1C may be persistently impacted by the increased red blood cell turnover related to pregnancy by blood loss and delivery or by the preceding 3 months glucose profiles. The OGTT is more sensitive and detecting glucose tolerance intolerance, including both prediabetes and diabetes. Women for reproductive age with prediabetes may develop type 2 diabetes by the time of their next pregnancy and will need to preconception evaluation. And because GDM is associated with an increased lifestyle maternal risk for diabetes mellitus estimated at 50 to 60%, women should also tested every 1 to 3 years thereafter if the 4 to 12 weeks postpartum OGTT is normal. So ongoing evaluation may be performed with any recommended glycemic test, annual A1C, annual fasting glucose, and or prenatal 25 gram OGTT using non-pregnant threshold. Gestational diabetes mellitus and type 2. Here we go for women with a history of GDM have a greatly increased risk of convergence to type 2 diabetes over time. Women with GDM have a 10-fold increased risk of developing type 2 comparing with women without GDM. Absolute risk increase linearly through women's lifetime, being approximately 20% at 10 years and 30% at 20 years and 40% 30 years and 50% at 40 years and 60% at 50 years. Both metformin and intensive lifestyle intervention prevent or delay progression to type 2 diabetes in women with pre-diabetes and history of GDM. What about pre-existing type 1 and type 2 diabetes? So insulin sensitivity increased dramatically with delivery of placenta. And one study, insulin requirements in the immediate postpartum period are roughly 34% lower than pre-pregnancy insulin requirement. Insulin sensitivity then returns to a pre-pregnancy level over the following 1 to 2 weeks. On women taking insulin, particularly attention should be directed to hypoglycemia prevention in the setting of breastfeeding and erratic sleep and eating schedules. And lactation. In light of the immediate nutritional and immunological benefits of breastfeeding for baby, all women, include those with diabetes, should be supported in attempts to be breastfeed. Breastfeeding may also confer longer-term metabolic benefits to the both mother and offspring. However, lactation can increase the risk of overnight hypoglycemia, and insulin dosing may need to be adjusted. Contraception use, a major barrier to effective preconception care is in fact that majority of pregnancies are unplanned. So planning pregnancy is critical in women with pre-existing diabetes due to the need of preconception glycemic control to prevent congenital malformation and reduce the risk of other complications. Thank you so much.